Radiation therapy. Radiation therapy refers to the use of ionizing radiation to treat variety of cancer. It may be used to obtain a cure in combination with surgery or chemotherapy or for palliation of symptoms when cure is impossible. So, radiation therapy means here we are giving ionizing radiations to treat cancer, and this treatment can cure the disease, or the radiation can be given as an adjunct with surgery or in combination with chemotherapy or for palliative treatment in order to reduce the symptoms. How does the radiation therapy work? We can see that radiation therapy works by damaging the DNA within the cancer cells, destroying their ability to reproduce and causing the cells to die. We knew that the cancer cells always reproduce, they will not die. Okay, so the radiation therapy, they will damage the cancer DNA cells in the cancer cells. That's why they destroy these cancer cells, so that the cancer cells will be die. When the damaged cancer cells are destroyed by radiation, the body naturally eliminates them. Normal cells also can be affected by radiation, but our normal cells have the ability to repair our cells. So that's why it can be damaged, but they will be repaired by themselves. That's why it will not be that much problematic. Radiation protection principle. The physical protection against external radiation is based on the following three principles: distance, time, and shielding. This principle is known as ALARA principle. The distance from the source of radiation. If the distance is increased, the rate of radiation will be decreased. It is inversely proportional. If the distance is increased, the rate of radiation will be decreased. It is inversely proportional. Next is the time. Limitation of the time of irradiation. So here we have to limit the time of exposure of radiation. If the time is increased, means there is increased chance of radiation. So that's why we will reduce the time limit, or we will be set the time limit for the radiation. So that is, time is directly proportional to the radiation. Next one, shielding. Shielding, usually we are using lead shielding. The shielding that will absorb the radiation, absorption of radiation, that is by lead shielding. So this we have to fear shielding materials in order to protect themselves from the radiation. So this is the ALARA principle that will help us to protect from radiation: time, distance, and shielding. Principles of radiotherapy. It includes 3 points: delivering of an optimal dose to the tumor. Second point, minimal damage to the surrounding tissues and organs. Third one, measures stimulating protective forces of the body. So the first principle is delivering of an optimal dose to the tumor. It means that we are giving high dose or a specified dose to the tumor only, not to the surroundings. Okay. And minimum damage. Our point is minimum damage to the surrounding tissues and organs. So we are giving high dose to the tumor only, and the surrounding area will be less dose, or they are getting a less dose. Then we are inducing the protective, our immunity will be induced by protective forces. Types of radiation therapy. Types of radiation therapy include external beam radiation therapy or teletherapy. Next is the internal beam radiation therapy or brachytherapy. External beam radiation type is the most common type of radiation therapy. Here we are using a machine that is known as the linear accelerator. Here the patient is not radioactive. Internal radiation therapy or brachytherapy means here we are using an implant that will be placed inside the patient body, and it can be done temporary or permanent, and patient is radioactive. Now we can see types of external radiation therapy. The type of equipment used will depend on the location, size and type of cancer. The first type of external radiation therapy is three-dimensional conformal radiation therapy, that is known as 3D CRT. Here, a technique where beams of radiation used in the treatment are shaped to match the tumor and are delivered accurately from several directions. So, here the three-dimensionally we are giving radiation to the tumor. A multi-layered or multi-leaf collinator is used to shape the radiation beam to match the tumor and sparing surrounding healthy tissue. So that is the benefit of 3D CRT. Here we are avoiding the healthy tissue. We are only giving radiation to the tumor. Then intensity modulated radiation therapy. In intensity modulated radiation therapy, a form of 3D CRT in which the physician designate specific doses of radiation that the tumor and normal surrounding tissues receive. So intensity modulated radiation therapy means here the intensity of dose is modulated. So here the physician designate specific doses of radiation that the tumor and normal surrounding tissue will receive. So that is known as intensity modulated radiation therapy. That is also a form of 3D CRT. Next one, image guided radiation therapy, that is known as IGRT, image guided radiation therapy. Here we are using or CT or MRI in order to give the accurate doses to the tumor. Next one, proton beam therapy. Proton beam therapy, a type of radiation therapy that use high energy beams, that is protons, rather than X-rays to treat certain types of cancer. Most commonly used in the treatment of pediatric, central nervous system or intraocular cancers. So proton beam therapy means here we are using high energy radiations like protons are used. Next one, stereotactic body radiotherapy or stereotactic radiosurgery. A specialized form of radiation therapy that focus high power energy on a small area of the body. Despite its name, radiosurgery is a treatment, not a surgical procedure. Radiosurgery generally implies a single high dose or just a few high dose treatment, that is known as stereotactic body radiotherapy. Here we are using high energy radiation. Brachytherapy or internal radiation. It delivers high dose of radiation to a localized area. The specific radioisotope is chosen on the basis of its half-life. For example, iridium-192 cesium 137, iodine 125, gold 198. All are the examples for the brachytherapy. Then brachytherapy is divided into two forms, that is sealed or unsealed radiation therapy. Sealed radiation therapy is again divided into interstitial radiation therapy or intercavity radiation therapy. Unsealed radiation therapy is systemic radiation therapy, usually IV or oral route. There will be systemic effects of radiation. In sealed brachytherapy, intracavity radiation therapy is there. So, intracavity radiation therapy means here we are using radioisotopes such as cesium that is 137 and radium that will be put inside the applicator and placed in body cavity for a specific amount of time, for example 24 to 72 hours. When treatment is completed, the applicator and radioactive material will be removed. And especially for reproductive cancers such as uterus, cervical cancer, we are using intracavity radiation therapy. In interstitial radiation therapy, we are using needles, beads, seeds or ribbons or catheters are placed directly into the tumor. Especially for the breast or prostate cancer, we are using interstitial type of brachytherapy. Here we are using radioisotopes such as iridium 192, cesium 137, gold 198. Here placement can be temporary or permanent, and usually it can be used for treatment of prostate, cervical or esophageal cancer. This is the example of interstitial brachytherapy. Here we are implanting or inserting radioactive materials directly into the tumor. In this picture you can see different catheters we are used in order to implant radioactive material, and it will be directly into the tumor. That's why the tumor size will be reduced immediately. This is the picture of intracavity radiation therapy. So for cervical cancer and uterine cancer, we can use this intracavity radiation therapy. Here we are introducing or implanting radiation materials close proximity to the tumor. That is intracavity radiation therapy. Here we are using applicators, and through these applicators radiation therapy is given. Based on the dose rate of radiation, the internal radiation therapy is again divided into low dose rate radiation therapy and high dose rate radiation therapy. Low dose rate radiation therapy that include seed implants. High dose rate radiation therapy include intracavity radiation therapy, usually in the treatment of breast cancer, gynecologic cancer, prostate cancer and skin treatment. We are using this type of radiation therapy. The main side effects that can be seen in radiation therapy is nausea, vomiting, diarrhea, xerostomia, ocular symptoms, edema, dryness, photophobia, oral mucositis, alopecia, hypothermia, headache, cystitis, esophagitis. The side effects we can see in the next class. So these all are the common side effects that can be seen in radiation therapy. I hope you understood regarding the radiation therapy. Thank you.